C. diff. Perhaps you've heard a healthcare provider explain this as something that you don't want to get, but you don't really understand what it even is. Or maybe you yourself have had C. diff, or you've known somebody that's had it, and this brings up emotions of fear and dread. In today's video, we are going to talk about what C. diff actually is and where it comes from. This is the first video in a 4-part series doing a deep dive into C. diff. And this video will introduce the clinical syndrome of C. diff and where it comes from. Subsequent videos will address practices for prevention and who is at risk, treatment and diagnosis, and recurrence. So stay tuned for those. I'm Dr. Katrina Coulter. I'm an infectious disease specialist, and I create educational health videos. Just a reminder, these are for health information purposes only and are not to be taken as diagnosis or medical advice. Please discuss this with your healthcare provider if you have any concerns. So C. diff is an infectious diarrhea, and it is at the intersection of my interests and my area of expertise because I am heavily focused on the microbiome, and we're going to get into the role the microbiome plays in this infection. C. diff stands for Clostridium difficile, and the infection it causes, if it could be summed up in one word, is diarrhea, or 2 words would be severe diarrhea. This is the most common cause of infectious diarrhea in the healthcare setting. That doesn't mean it can only occur in a healthcare setting, but by and large, the cases that we see are in the healthcare setting, and that's because of its close association with antibiotic exposure. About 65% of cases will occur in the healthcare setting, and of the other 35% that occur outside of an inpatient healthcare setting, 80% of those have had recent outpatient healthcare contact. And so this is a big burden on the healthcare system. It's expensive, but it's also devastating to the patient that gets it because this can be an unrelenting diarrhea. The clinical syndrome is described as greater than or equal to 3 or more unformed bowel movements in a day. This means loose stools with no form. This definition has changed over the years. Back in the 80s, we used to say 6 stools a day in a 24-hour period. And the other important piece of this is that you don't have another explanation for the diarrhea. So it's not occurring because you ate a food that didn't agree with you and you know that food doesn't agree with you, or because you took a laxative, or because there's some sort of viral stomach bug running through your household. This is diarrhea that kind of comes out of nowhere, usually after antibiotic exposure, and is unrelenting. So after that 24-hour period, it typically doesn't go away. It goes on and on. Now, there is a whole spectrum of disease, and that's really important to understand because this disease can run from being completely asymptomatic or only having a couple episodes of diarrhea, all the way to having a very severe infection of the colon called toxic megacolon, in which some people have to have parts of their colon taken out, all the way to the most severe form, which can cause death. So this infectious diarrhea is no joke, and if you're somebody that's experienced it, you know that this is very problematic to where you cannot leave the house. It is absolutely impairing your quality of life, and there is a high risk of recurrence, which is a whole other problem we'll discuss in a subsequent video. This C. diff infection can also be associated with abdominal pain and cramping, and although it's not the typical presentation, vomiting often is present in certain patients, as well as fever. On our lab testing, we usually will see an increased white blood cell count. So, severe diarrhea greater than or equal to more than 3 episodes in a 24-hour period should make you start thinking about this. Now, I discussed that there was a spectrum of disease, and that is going to be an important takeaway from this video. This Clostridium difficile is a bacteria that does exist in the environment. And so it comes into our body on produce. About 30% of the produce in the grocery store will have C. diff on it. It's also on high-touch surfaces like shopping cart handles, doorknobs, movie theaters, and also the hands of healthcare workers, which is why hand hygiene is so important. And bonus, it is not killed by hand sanitizer. You actually have to wash your hands with soap and water. But what I really want you to understand is that some people have this normally in their colon without causing any problem. So if we were to test their stool, we would find this bacteria present, but they're not having diarrhea. So it can be a normal part of our microbiome. And if you are new to the term microbiome, those are the trillions of microbes that exist on us and inside of us, largely in our gastrointestinal tract, that are viruses, bacteria, fungi, amoeba, and they help us interact with the outside world. We could not exist on planet Earth without our microbiome. And it turns out they are crucial to our health functioning. They help our immune system train, they help us harvest our energy, but also influence our metabolism of that energy. They help us make neurotransmitters and influence our mental health, our hormonal cycling, so many things. So really understanding what affects your microbiome and how to take care of it is the first step in nourishing good health. So C. diff can be part of the normal microbiome, and actually in infants ages 6 to 12 months, it is part of the normal microbiome. About 40% of infants have C. diff in their intestines and they have no symptoms from it. About 2% of adults just kind of walking around in the normal population will also be colonized with C. diff. And if you look at adults in the healthcare setting, then we're looking at more like 30%. Well, what does this mean? Does this mean you are at increased risk for C. diff? Not necessarily. We're actually finding out that the presence of non-toxigenic strains of C. diff might be protective or are protective in preventing the actual infection of C. diff diarrhea or C. diff colitis. Why is that? Because they outcompete for resources with these more toxigenic strains. And it is the toxigenic strains that cause the problem. The toxigenic strains produce toxins that cause severe illness. And this bacteria, Clostridium difficile, is in this larger group of bacteria. The genus is called Clostridia. Also in this group is Clostridia perfringens, which causes gas gangrene from toxin production, and Clostridium botulinum, which causes botulism. So there can be some severe diseases that come out of this genus, but very interestingly, and what I want you to understand is that these are actually helpful bacteria that play a role in our intestines. So there's other species of Clostridium butyricum that produces short chain fatty acids, which are metabolites that actually are very essential for our health and functioning. They produce a short chain fatty acid called butyrate, and I talk about that in a lot of videos. And butyrate maintains our intestinal cell wall. It helps turn down inflammation in our intestines and really helps the functioning of our immune system, as well as edges out pathogenic bacteria. So the story is complex. C. diff is not just a bad guy. C. diff is a bad guy in the right setting. And that's what we are going to get into in our next video, is who is at risk and strategies to help prevent getting C. diff diarrhea. I would love for you to subscribe to my channel, like or share this video, and stay tuned so that you don't miss our next video in the C. diff series. Thanks for watching.